Hey everyone, today I wanted to answer some questions that I've seen about how are group health plans going to determine if they are creditable with the new Inflation Reduction Act $2,000 maximum out-of-pocket on prescription drugs. So this has been a big concern for a lot of people because many people work past 65. They have family members, spouse, children, or dependents who are relying on them for insurance, and so they can't just leave and go to Medicare. They need to keep their coverage for their family. But are they going to get a Part D penalty? Are they going to be penalized because their group plan is not equal to Medicare? And that's the way that the regulation is written, or the law. It is that an employer group plan can be creditable coverage if the coverage is equal to the coverage or better than the coverage of Medicare. Well, with the new Inflation Reduction Act, $2,000 maximum out of pocket, and my video in the last few days, I've shared that some people are hitting their maximum out of pocket only spending $329, not $2,000. How is a group plan going to be considered creditable? So I'm going to answer that question right now, but first I want to tell you a little bit about the group plan that I have through here at Nouveau Health. We have a group plan for our employees, and we have really solid benefits, honestly. And my family and I, we paid extra to have a plan with a $12,700 maximum out of pocket. $12,700. We paid extra for that. Per individual, it's $6,350 individual maximum out of pocket. And we did that because we wanted to have a low deductible. And in Medicare, in individual and group health insurance, a low deductible is $1,500. So my family has a $3,000 family or a $1,500 individual maximum out of pocket. And this week I received my notice in the mail, just like I'm sure all of you will, that says my Medicare Part D notice. And this is the 2025 Medicare Part D notice from my employer group health plan. And remember, I just shared with you my benefits: a $3,000 family, $1,500 individual deductible. Now that's a total deductible. That's not on prescriptions, and a $12,000 plus maximum out of pocket. So it says creditable coverage information. The prescription drug coverage offered under this group health plan is on average for all plan participants expected to pay out as much as the standard Medicare prescription drug coverage pays, and is therefore considered creditable coverage. Because this coverage is creditable coverage, you can keep this coverage and not pay a higher premium or a penalty if you decide to join a Medicare plan later. So my plan is considered creditable. I did some experimenting and I ran some prescriptions, some expensive prescriptions on my plan, and honestly the coverage is pretty solid. But I proved through the website that I was able to spend much more than $2,000 on prescriptions with my plan. So how is it that this plan is considered creditable? And by the way, I said this already, but I paid extra. This is not the base plan by any means. The base plans, you know how the base plans are. The base plans are like $20,000 family maximum out of pocket, $10,000 individual maximum out of pocket. I mean, they're just extreme, right? So I've paid extra for this to have better coverage for my family. So even those plans with a $10,000 max out of pocket are considered creditable coverage. So how? Well, this is how. CMS, and I think there's a lot of politics involved here, because if you can imagine, there's already so much stirring right before an election. But if you have all of these people who are already having challenges with Medicare, plus all the people who are working, finding out that their coverage is no longer creditable, that would be a political storm for the people in power. So I think that part of this is politically motivated. So CMS said that employers do not have to actually do a full financial review, which they already know the numbers because the insurance companies have actuaries, but they don't have to do an actuarial review to determine if their plan is equal to Medicare. They could use what is called the Simplified Determination Methodology, the same one that existed in the past. Regardless of the changes to Medicare's prescription drug coverage, which are extreme, employers could use the Simplified Determination Methodology. The Simplified Determination Methodology uses 3 key points to determine if a plan is considered a creditable coverage plan. And the first one is the deductible on prescription drugs has to be less than the deductible on Medicare's standard benefit for prescription drugs, which is $590. If the deductible on prescription specifically, not on the health plan, but on prescription portion, exceeds $590, then it cannot be creditable. So that's the biggest hurdle that they have to jump. Other than that, these next hurdles you'll see are really not hurdles at all. So it has to have a deductible lower than $590 on prescriptions. The second thing is the coverage has to cover brand name and prescription medications. Now, I don't know of a group health plan that exists out there that doesn't cover brand name medications. So easy one to jump, easy one to clear, has to cover brand names and generic prescriptions. And the last one is the actuarial value of the coverage for prescriptions has to be at least 60% of the cost of prescriptions. 60. Now, the Medicare standard benefit is 75%. It's 25%, the member pays 75% that is paid on their behalf. That's the minimum. But for the simplified determination methodology, it only has to be 60%. So if the plan is covering at least 60% of the cost of the prescriptions, then it's considered creditable. So by these standards, I think that there will be no difference in the plans. There will be essentially no difference in the plans, the group plans being creditable or not from 2024 to 2025. And so that is a good thing for those of us who have a lot of clients and people we know who are on group health plans and have to stay there because they're covering their dependents. But it's not following the law, and it's questionable. But you know what? I'm an advocate for seniors, so I'm really glad about that. At the same time, I'm also an advocate for insurance agents, so I'm happy about it. I'm also a citizen of the United States, and so I'm frustrated with some of the tactics that I've seen this year around hiding the actual cost of the Inflation Reduction Act and the $2,000 maximum out of pocket. I mean, even the beneficiaries aren't paying the increase in the cost. It's being paid by the government, and that was not supposed to be. So those are my raw thoughts around the Simplified Determination Methodology, and I hope that that helps you understand how a group health plan can be considered creditable coverage when it in no way matches Medicare's prescription drug coverage in 2025.